Hello everyone. So welcome back to my YouTube channel. Today I'm going to discuss about the pulp vitality test. Okay, how to do the pulp vitality test. Okay, in this video you will see the various tests will be done to check the vitality of the pulp. Okay, this is the one of the most important question for the exam accept also. Okay, aspect also. Okay, so basically what is pulp vitality test? This is the test used in endodontics, okay, to assess the status of sensory nerve of the pulp. So basically to test the sensory nerve of the pulp, we do the various tests. Okay, so let's begin the journey of this video. Okay, so what all the tests I am going to discuss in this video is आपका thermal test, electric pulp test, percussions and palpitation test. Okay, then test cavity, then anesthetic test, bite test. Okay, so first is thermal test. Okay, so what is this thermal test basically of? Okay, so thermal test is of two types. Okay, cold test and heat test. Okay, in cold test we use the agents like ethyl chloride or CO2 snow ice, endo ice. Okay, these are the agents which we use to test the sensory of nerve of the pulp. Okay, if the positive response, if the positive comes, okay, normal or reversible inflammation is there. Okay, if the pain is persist, okay, it is irreversible pulpitis. Okay, this is the cold test. Okay, so coming to the heat test. Okay, hot gutta percha or warm water is the agent, okay, for this heat test. Okay, so basically what we'll see is pain. If we put the heat on the tooth, okay, pain on the heat relieved by the cold is irreversible pulpitis. If we put a hot gutta percha on the tooth, if the pain is there and we withdraw that, if suddenly the cool temperature will happen, so what will be that? That will be the irreversible pulpitis. Okay, so next is electric pulp test, which is also known as EPT. Okay, so what we'll do here, what it does is measure the sensory response using the electric stimulus. Okay, here we measure the sensory response, okay, by using what? Electric stimulus. Okay, gives sensibility, non-vitality. Okay, so false reading in the tooth with immature apex, calcification, trauma. Okay, it is the what all will be immature apex, calcification and traumas. Okay, so how we do this test is, first you explain the patient about the procedure. Okay, so that the anxiety of the patient is reduced. Then isolate the area with the cotton roll. Okay, whichever the tooth you are going to examine, isolate that area with the cotton rolls. Okay, then apply electric rods. Okay, electric rods you should apply over the tooth. Okay, tooth electrodes. Okay, place it over occlusobuccal or incisolabial, okay, surface of the crown. Then turn out the rheostat scale gradually, slowly you on the scale, this one rheostat scale. Okay, then you can record the response of the patient. Okay, this is the technique how you will use the electric pulp test. Okay, so next is percussion and palpitation. Okay, so what is percussion? Basically nothing but the tapping on the occlusal or buccal surface. Okay, with the instrument mouth mirror ka backside and you will tap on the occlusal surface or buccal surface. Okay, if the indicates inflammation of the periodontal, it mainly indicate the if any inflammation is present in the periodontal ligament, it will give the response. Okay, what is palpitation test? Apply pressure on the mucosa over the root apex. Okay, near the root apex you will apply the pressure. Okay, that is called palpitation test. Okay, positive response मतलब periapical inflammation is present. So next is periodontal examination. Okay, what we will do here is probing depth to differentiate between endo lesions, periendo lesions, combined lesions. Okay, you will put a probe and check for the endo lesions, endodontic lesions are there or periodontal lesions are there, or both endodontic and periodontic lesions are there or not, and to check the mobility or any furcation is involved. Okay, you will check, you will do the test. Okay, next is test cavity. Okay, so this is the latest test. Okay, drill without anesthesia. Okay, to check the vitality. If you drill, the patient will have a response. Okay, that is called a test vitality. How you will do is, cavity is made with a half round burr along with air and water coolant. Okay, both air and water coolant will be there. Okay, you should not give the patient the anesthesia. Okay, observe the patient response. Okay, how patient is responding. Response, if any response is there, restore the cavity. If no response, continue with the pulp chamber. Okay, then you can carry out with the endodontic therapies. Okay, so this is the test, cavity test. Okay, next is selective anesthesia test. What you will see here, used to identify the offending tooth when the pain is referred. So what you will basically do is anesthetize the most posterior tooth. Okay, so go for the susceptible quadrant and anesthetize the most posterior tooth. If pain is relieved, then the tooth is located in between that. Okay, if pain is persisting, repeat to the adjacent tooth. Okay, if no response, repeat it for the upper arch. Okay, like that you will do the anesthesia test. First you will give anesthesia, then see if any thing is there or not, pain is there or not. If pain is located, that area is somewhere the tooth having the infection. Okay, like that. If not, go for the opposite arch. So next is bite test. So what you will do is, purpose of bite test, matlab what you will do is to detect the cracked tooth syndrome. Okay, so if there is any cracked tooth syndrome is there, you and to identify the vertical or root fractures, you can use this test to localize pain when the patient cannot identify the tooth. Okay, if patient is not able to tell you which tooth is getting pain, you can use this bite test. Okay, to differentiate pulp and periapical pain. Here in this test you can differentiate is there any pulpal pain or periapical pain. Okay, next is what you will use here. Common tools for what tools you will use here is tooth slot, either be cotton roll you will place it, or orange wooden stick you can place, or rubber wheels, or q-tip, or bite stick, or fact finders. Okay, these are the things you can use. How you will use this, patient is asked to bite over the object, over the susceptible tooth. Okay, patient is asked to, if example you are using a cotton roll, so patient will ask the patient to bite between the tooths. Okay, record it, compare with collateral tooth. Okay, if any pain is there, you will get to know. Okay, if not, go for the other tooth also and check the same. Okay, this is how you will do the bite test. So this is the thing which we'll see for the pulp vitality test. Okay, first is thermal test, in that heat and cold test. Okay, next we have discussed about the electric pulp test. So you know what are the how you have to do it. This is also a 5-mark question. You have to read it properly. Okay, then is test cavity, how you will test the cavity. Okay, then you have learn about the what do you say, bite test also. You have known that, and anesthetic test you have seen in this video. Okay, then bite test also, as I told you, it is also the most important test. Okay, you can use for the endodontic evaluation investigations. Okay, diagnosis purpose, which tooth is paining, which is not paining, you can identify through this pulp. Okay, for the investigation purposes. Okay, the main you have to study this answer, because here the question has discuss various diagnostic methods in endodontics. Okay, this will be your 10-marker question, so study it properly, read it properly. Whatever the procedure I have shared you take the screenshot and make the notes of it. You can write that much also, is more than enough, so that you can easily, I have made this in a very simple form. Okay, I have not gone deep like other people, so I have made it in what is the most important point you have to write. That much only I have given you in this. Okay, so read it properly, study properly about this video, about this question. Okay, if you like my video, do like, share and subscribe my video. Thank you so much. We'll come up with new topic in the next video. Stay tuned. Thank you.